Pregnancy, a roller coaster of emotions that a select few of us get to experience. Almost little compares to the excitement and anticipation of what's to come. But what if despite all of your best efforts, it's just not happening? Well, with lots of love and a little bit of science, you too get to experience your bundle of joy with in vitro fertilization. Hi, I'm Kamsi.
And I'm Jazzy.
We're both pharmacy students from the University of Newcastle.
And we're also both wearing lab coats, which means today we're going to discuss the medications involved in your IVF treatment. Yay!
Before we get into the IVF medications, we would need to understand the basis of the menstrual cycle. So, the menstrual cycle starts with the release of the gonadotropin-releasing hormones from the hypothalamus to the pituitary gland. Here, this would release FSH and LH, which would work together for the growth and release of an egg from the fluid-filled follicles in an ovary. Now, during regular ovulation, your body produces one egg at a time, which then travels down the fallopian tube and gets fertilized to produce an embryo. Now, IVF manipulates this process, whereby increasing the number of mature eggs collected, then they're fertilized in the lab. One embryo is transferred at a time into the patient with supplementation, while the rest are frozen for subsequent use if the first try is unsuccessful. This process often increases the chance that pregnancy will occur.
The medications involved in your IVF treatment. So most of these medications will come as injectables, but the dosing will vary depending on what your treating specialist recommends. So before we talk about the medications, I'm going to divide it into 3 steps. So 1 is to stimulate ovulation, 2 is to prevent premature ovulation, and then lastly, we're going to prepare your uterine lining for implantation. There are about 3 medications that we're going to deal with in stimulating ovulation. For the first medications, anti-estrogens are used in patients that are having difficulty in stimulating ovulation itself. It helps by increasing follicle production. The next one is FSH. So the anti-estrogens would help stimulate one egg, while the FSH is going to mimic natural hormone as previously discussed by Kingsley in the menstruation cycle, and that's going to help us produce more eggs. So the human chorionic gonadotropin, or HCG, is the last medication in this step. It works similarly to LH when LH has that surge to release the egg for ovulation. HCG is typically given about 2 days after the last dose of FSH. So it allows us to time ovulation precisely and allow us to collect the eggs before they are released from the ovary. Let's talk about premature ovulation now. So there's 2 medications that's going to be involved in this. The gonadotropin-releasing hormone antagonist and the gonadotropin-releasing hormone agonist. So these medications are tailored to individual needs, and your specialist will tell you which one will be more tailored for your therapy. The way they work is they suppress the pituitary gland. You can think of them much as a traffic light, actually. So an antagonist is like the red light. It stops the FSH and LH from moving down into stimulating the ovary. You can think of it as a green light, the agonist. So the agonist works by overstimulating the pituitary gland initially to secrete a lot of FSH and LH, but that overproduction is eventually going to suppress the pituitary gland from secreting any more, thus preventing premature ovulation. Antagonists are usually given on day 8 of follicle-stimulating hormone treatment, and they keep going until the follicles are mature. An agonist is given once or twice daily for about 7 days. Antagonists usually come as injectables, whereas an agonist can come as either an injectable or a nasal spray, which is good for patients who may have a slight phobia of needles. On the day of the egg retrieval, or the day of embryo transfer, your doctor may recommend for you to take progesterone supplements. Progesterone is a naturally occurring hormone that occurs in the second half of the menstrual cycle. Its role is to optimize the uterine lining for implantation of the egg. An advantage of IVF is that if your first cycle was not successful, we can still use another frozen embryo to embark on another cycle. A medication we might use for this is Prognova, which is a synthetic estrogen replacement. This medication is started on the first day of your menstrual cycle up until your pregnancy test. If your pregnancy test is positive, this medication will be continued for another 6 weeks. If, however, it's negative, your medication will be stopped and your period will restart after a few days. So as we all know, it's important to consume a balanced diet. We want to increase our intake of folate, vitamin D, magnesium, zinc, and omega-3 and iron while we're doing these IVF medications to increase the chance of success. Organic foods has also been shown to increase your IVF success rate, as there's lower amounts of toxins in organic foods. We also know that smoking, recreational drugs, and alcohol are bad. Even pesticides as well, and some beauty products. Plastics are also a source of hormone-disrupting chemicals as well, and can wreak havoc on male and female fertility. BPA plastics are no better as well. It is best in this case to use a glass or steel option, for example, if you're using a water bottle.
So, now that you're aware of all the medications used during IVF treatments, just like any other medication, there's the possibility of side effects or adverse reactions. Common side effects include hot flashes, mood swings, depression, nausea, breast tenderness, swelling or rash at the injection site, abdominal bleeding, twinges of abdominal pain. A not so common side effect is ovarian hyperstimulation syndrome, also known as OHSS. OHSS usually occurs within 7 to 10 days of the HCG trigger injection. Symptoms range from mild abdominal discomfort or bloating to severe abdominal pain. This is caused by the massive ovarian enlargement and ascites. Vomiting and dehydration could also be symptoms. You should definitely seek advice from your reproductive technician if OHSS is suspected. So I'm going to give you 5 ways on how to reduce fertility drug side effects and risks. So 1, try taking the medications at night or with food just to reduce GI upsets. 2, talk to your doctor about the best way possible to take the medications. 3, try starting with a lower dose, that is the lowest effective dose. And 4, let your doctor know about any side effects whatsoever. It doesn't matter how little it is, let your doctor know. 5, listen to your doctor, especially if the chances of multiples are high. Today, about 1 in 25 Australian births are an IVF baby. For women starting IVF, 33% have a baby as a result of their first cycle, increasing to 54 to 77% by the 8th cycle. However, these percentages vary by maternal age. So, the sooner you start an IVF treatment, the higher the likelihood of success.
So that concludes our presentation on the medications involved in your IVF treatment. Now, this is a big decision and we understand that you have lots of questions and concerns, but that's what me and Kenzie are here for.
I hope we've been able to improve your knowledge on the medications used during IVF treatments with their side effects. And if you do need any more resources to refer to, you can definitely go to www.ivf.com.au or the brochures directly on your IVF clinic website.
So we are available to answer any questions or concerns you may have.
Thank you very much.